I graduated from University of Tennessee in 1999, then went to California to do residency at Huntington Memorial Hospital in Pasadena. Had a great experience there. But at that point in time, figured I had enough of big cities and decided to set up practice in smaller towns. So my first practice was in Northern California, in Eureka. I practiced there for a total of 7.5, almost 8 years. And then went to Bend and practiced there for 1.5 years. The most common things are gallbladders and appendixes. Taking out people's gallbladders, taking out appendixes, but do the full gamut of general surgery. Colon surgery, I've done head and neck surgery with thyroids and parathyroids. I have a real interest in doing bariatric surgery. It's minimally invasive, so instead of using a big open-up incision to do surgery, you do it through several small incisions and use a camera to visualize things and long instruments to manipulate the organs that you're operating on. And so quicker recovery times, less pain, and quicker back to being normal. I enjoy taking people who have illnesses and things that can be helped by sometimes a simple procedure, sometimes a pretty complex procedure. But 30 days, 45 days, 3 months later, their lives are different because of something that I did to help them. It's really rewarding. Surgeons in smaller towns tend to take more time to get to know people. They have a little bit less of an academic kind of attitude. Part of what's driven that for me has been that when I went in and did surgery with my father and took call with him, in the middle of the night he'd know the name of the janitor, he'd know the name of everybody, and realize that everybody's part of a team, and you can see people when they're sick, they rely on you as someone that's going to do the right thing for them. And I learned very early on when I was young how much people depended on my father to help them get through what they were going through. So it feels to me like everybody is important in taking care of the patients. We can't do things if the rooms are dirty, and everybody has a role that is being filled, and part of that role for the patients is the reliance on me as a person, so I have to be the most honest and helpful person to them that they can get.